Hello, everybody. Welcome to Community Conversations here at Atlantic Health System. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health. And seated to my left, or the right of your screen, is Dr. Diana Contreras. She is the Medical Director of OB-GYN and Women's Health here at Atlantic Health System. Doctor, thank you so much for joining us today.
Well, look, I really appreciate being here. I enjoy talking about my favorite things, which is how to take care of women.
Excellent. Well, we appreciate you doing it here. For those who have never seen one of our programs before, I'll give you a brief little overview on how to work, and then we'll dive in. So this is a conversation between not just Dr. Contreras and myself, but also you too. We have a number of questions that were submitted ahead of time, so thank you to everybody who did that. But if you hear something from us that you just want a little bit more information about, or if you have your own question that you want to submit now, feel free to type it in. And we've got folks who are keeping an eye on things who will try to share as many of those with me as possible, and I'll try to get through those and allow Dr. Contreras an opportunity to answer as many as we can in our time allotted. Now look, internet connection being what it is, maybe everybody's got a busy schedule. If you got to drop out and you miss something that we discuss here today, this whole program will live on our Facebook page, but it'll also live soon on our YouTube channel and on our website, atlantichealth.org, where you can find all of our previous community conversations. We've been doing these, Doctor, since last April. So we've got quite a few of them to go through, a lot of subjects covered, but maybe no subject that can be as challenging for some of us to talk about as this one. I am not a woman, so I am not as familiar with some of these issues as perhaps some members of our audience. And Dr. Contreras, you and I were talking a little bit about this before we went up. Even for women who have experienced some of these things, this topic can be tricky or complicated to talk about. Why do you think that is?
Well, I think sometimes these are issues that people are a little uncomfortable bringing out into the public and having discussions. This is frequently discussions you have with your mom, your sister, kind of girl talk, and really you should be having with your gynecologist, because it's really got to be with people who are comfortable. A lot of women aren't even comfortable talking about it themselves. Certainly it's a topic that we as gynecologists are super comfortable with, and really the right people to bring the issues to. So
we're going to go over a lot of things today, whether they be reproductive health or just sort of the different experiences that women have throughout their lives, the different stages of their lives. We will address some COVID-related questions, because I know we got a couple of those submitted to us in advance. So we're going to try to move quick, but like I said, if we go through something that you want a little more information on, please don't be shy about sending us a message. So the topic of the title, if you will, of this is why every woman needs a gynecologist. And let's start there. Why does every woman need a gynecologist?
So everyone needs a gynecologist, and not only do they need a gynecologist, they need it throughout their entire life. And people will say to me, well, why, right? Why not somebody else? Well, first of all, you start with a gynecologist, right? And when should you start with a gynecologist? It's a question a lot of people ask. When should we have our daughters have a gynecologist? And really, it can start at any time, 11, 13, and really it starts off with your first menstrual period, right? And that's an important discussion. A lot of young women, as women do as they age also, have menstrual issues, right? Vaginal bleeding, discomfort. And really, who's more comfortable than a gynecologist to talk about that? That is fundamentally who we are. And so it's a really important time to have those discussions. Then, you know, the issue is a lot of women, as you can see in what's been going on in the news, a lot of women are seeking forms of birth control. It isn't always the pill, right? There are many different forms out there, and there's some really great, reliable forms out there. And that really needs to be a discussion you have with the gynecologist, because it's individualized. What works for me? Right? And I think that's important, and it may be different things at different times in your life. Then, as you progress through the idea of pregnancy, you know, you need to, pre-pregnancy, have a discussion with the gynecologist about the things you need to do so you can try to have the healthiest pregnancy possible. Then if there are any issues with infertility, you might want to have discussions about that. And so that's where, you know, we start off with the gynecologist, and then after you've potentially had your children or want to take time in between your children, you want to have another form of birth control, and it may be different than what you started off before. Okay. So things change over time, right? And what you wanted when you were 18 may be different than when you're 30 or 40. And so it's really important that you have a trusted relationship with somebody who's truly comfortable discussing these issues. And that would be your gynecologist. And as you continue to age, there are different issues that become important to you. So do you still need birth control as you age? Well, I'm going to tell you, you can get pregnant if you are still having your periods and are sexually active. So that's a discussion that you should have with your gynecologist. Then women have different issues related to intercourse as they age. There are issues with pain with intercourse. There are issues with even how you're mentally handling it. Again, issues you want to share with your gynecologist who is prepared to handle a lot of these issues. So as you age, there are different issues. Then you can talk about issues related to urinary issues. Once women have a baby, a lot of them have trouble holding their urine when they sneeze or they laugh. And these are things that a gynecologist can help you with, but frequently people don't want to talk about it, right? Those are a lot of tough issues, and it's important.
The relationship that a patient has with their primary care physician and then with the gynecologist, is it mutually exclusive? If you have a good relationship with your primary care physician, do you still need to have a relationship with the gynecologist? Vice versa, there are some women who have a gynecologist and that's who they end up seeing for the most part. What about that balance between those two types of physicians, the primary care physician and a gynecologist?
You know, that's a really great question. And I think there's no one size fits all. So if you're the person who has diabetes and blood pressure issues and needs a primary care doctor to take care of those, great. But that doesn't mean you're not also having issues with your periods or with urinary issues or other things. And that's where a gynecologist really fits in. So if you're not having any of those chronic medical problems and you want to use your gynecologist as your primary care person, that's great because they can take care of the issues as well. But if you have a primary care person who's comfortable with dealing with many of these other issues that can feed into it, that's great too. It's what you individually need.
So for those who may have a primary care physician but don't yet have a relationship with a gynecologist, this is my opportunity to share for those who have been to our website or even for those who haven't. If you use the Find a Doc link at the top of the website, you can sort
Absolutely.
by those specialists, so you could very easily find a physician you're looking for on our website. So I'd encourage people to check that.
Yeah, absolutely. I do also want to talk about that time when you don't want to have a baby and you need birth control, and you go into this perimenopausal period, where it's really important that women talk to their gynecologist about anxiety, sleeping, depression, vaginal dryness. There are a lot of issues that come into this. And then we can move into menopause where people can have hot flashes, mood swings, where sometimes you just think you're losing it and you're like, what is going on here? And it's really, some of those are menopausal symptoms. And so who better than to talk to your gynecologist? And I think it's really important. That's why it's really important that everyone have a gynecologist, because that's the person you trust with all these kind of feelings that are hard sometimes to share with people and share with another physician. So it's really important you have that long trusted relationship.
I think that is the perfect opportunity to start to weave in some of the questions we got submitted to us, because many of them, in fact almost all of them, touch on some of the themes that you've brought up. So let's talk into a couple of these. And again, I would remind folks, if we don't get to something that you want to talk about, please feel free to put it in the chat section. Please try to remain on topic. Certain questions regarding orthopedic stuff, or we have many specialists who we've done community conversations with in the past, but let's try to stay on topic for this one because we have a lot to get through. One of the questions you asked about, or one of the questions you mentioned is about the differences as we age. One of our folks who are watching, Deanna, wants to know, at 77 years old and healthy, do I still need to have a pap smear and mammogram? She also adds that she's had 2 natural childbirths as well as part of her life history. But does she still need that level of screening and attention at 77?
So yes and no. And so it's a very individual process, and that's why I recommend that you go over it with your gynecologist. A lot of it is dependent on what your pap smear history was in the past. And so I can't answer it directly because it depends on your personal history as to what's going on. There's recently been some literature suggesting, since women are living a lot longer than they used to, we need to make sure we're preventing all kinds of things. So it's really about you and your history, and I would bring that to your trusted gynecologist to have that conversation about you individually.
You also brought up menopause, and Denise wants to know if you're having hot flashes and mood swings for more than 10 years in your mid-60s, is that still menopause related? And I guess what we'd say is, could that still be menopause related? Because you can't, as Dr. Contreras has said, we are not going to diagnose anybody or answer anybody's question too specifically via Facebook as much as we might want to. Those are questions best directed to your physician. But is it possible that women in their mid-60s could still be having menopause related symptoms?
Absolutely. Like and I think it's really important. People assume that you're up here and you drop right into menopause, like you cross the finish line in a race.
And it's like,
all
done, over,
It's
right.
not like that, okay? So you go through up here in life, and then you kind of slowly make your way down. And so different people are different. And so why I would suggest to you, again, this is exactly why every woman needs a gynecologist, because you need to have that conversation with your gynecologist. We are all different, and we get to that finish line or that different part of the race differently. And so everybody has to have that conversation. And I think it's also important that you have that long relationship so your gynecologist knows what's going on with you. So 2 years ago you were here, this year you're here, and next year you're somewhere else. And I think that's really important because we don't all follow the same path.
We have a question from Margaret here, which is interesting to me. It is similar in the vein of of a woman who has reached a certain age. Is it really necessary to continue to have some of these screenings? But the last portion of her question, I think, resonated because it's something we've heard in conversations with a number of physicians. And essentially, her question is: it's been a long time since she's had a gynecological exam, and to be completely honest with you, she's afraid to have one because it's been a long time. She's afraid there could be bad news there, whether there's clinical signs or otherwise. Just having not had that relationship with a gynecologist, having not done that work in a while, there's a level of fear and trepidation around doing it. What's your response to somebody who said, look, I don't want the bad news, if there is any?
So there may be two reasons why she's afraid. One is she's afraid of bad news, and I would say to you, chances are there is no bad news. Get your exam done so you can then rest assured that there is no bad news. Sure. And the other, are you afraid because you're afraid of bad news, or are you afraid because it could be uncomfortable? And I think that's really something that you have to think about, and then share that with your gynecologist. Gynecologists are used to doing pelvic exams, and there's all kinds of things we can do to make it more comfortable for people. So it's really about sharing that information and thinking about why you're afraid, because we're here to help. That's really what it is. Being a gynecologist, you're here to help women get through all the different phases of life, and we really want to help. So I would share whatever it is you're feeling with your gynecologist so that they can help address that issue for you.
Let's pivot to pregnancy. We have one of our folks was wondering about age and pregnancy. Is it possible, and I think you touched on this earlier in one of your comments, is it possible to get pregnant for the first time after the age of 40? Is there like a finish line with menopause we talked about? Is there a finish line with pregnancy?
So the finish line with pregnancy is that you stop having periods and you stop ovulating. Ovulating is where the egg comes out of the ovary and then travels through the uterus where it can meet a sperm, and then you can get pregnant, right? So when that ends, it's over.
Then it's over.
Okay. Until that ends, you can still get pregnant. At any time, that ovary can meet that sperm, you're set. That egg, that sperm, you can get pregnant. Is it harder when you get older? Yes. Doesn't mean it can't happen. And we're seeing lots of women who are getting pregnant as they get older. So can it happen? Absolutely. And that's why I tell women, there have been always a lot of oopsies in this world.
Sure.
Right? Oopsie pregnancies, there's nothing new with that, right? If you don't want to get pregnant, we have lots of ways to help you to avoid that. If you do want to get pregnant, we also have lots of ways that we can help you with that. So lots of great issues that you should talk about with your gynecologist, because it's about empowering you to own your health care. And that's really what this is about. Sure. It's empowering every woman to be informed, to be educated, and to really deciding what she wants. And I think that's really the critical part about having a gynecologist. It's empowering women to own their health.
Informed and educated around pregnancy leads me to a topic that we got some questions about. They're all basically the same, and it has to do with what we're all going through right now, and of course that's the pandemic. There are a lot of women who are concerned about what they might have read online, heard from friends, anything along those lines as it relates to vaccination and their potential to be pregnant on down the line, the idea of fertility and what we know at this point regarding that issue. For women who are holding off on being vaccinated because they are concerned about whatever implications they may have heard about as it relates to fertility, what do we know to be true at this point? What are the facts, separating the fact from fiction here?
Okay, so I'm really glad you asked this question because it's really important that people understand. The COVID-19 vaccine does not cause infertility.
Full stop.
Full stop. That is very clear to the science speaks to it. It is very clear to what the American College of OB-GYN says, the Society of Reproductive Medicine, the CDC, the WHO. There is no data that will tell you that infertility and the vaccine are linked. So I want to make it very clear, it is not, in no way is it linked. As far as COVID vaccine and pregnancy is concerned, it's important people realize that we have vaccinated a significant number of women prior to being pregnant, as they're pregnant, during their pregnancy, and women have gotten pregnant during their time that they're getting the vaccine. So we have a lot of women who we've been following for a significant number of times. There was a recent paper written about over 130,000 women who have been in that situation. Either they got the vaccine and didn't know they were pregnant, got the vaccine and during the 2 doses they got pregnant, or took the vaccine while they were pregnant. And what we have seen is no adverse outcomes for those women or for their babies.
More than 100,000 people.
Right. It's really more data than we have had on a lot of things. So it's actually very, very reassuring and really important. What we do know is that if you are pregnant and get COVID, you are at higher risk for having some really serious bad outcomes for you and your baby.
And that's, I wanted to touch on that too. What do we know about either the mortality or the effects of COVID on pregnant women? It sounds like there's a larger increase for an adverse reaction than there would be for non-pregnant people.
Yeah, so it's pretty serious as to what can go on. And one of the things that we know is that moms can end up sicker than non-pregnant moms. So you take two 25-year-old women, both have COVID, one is pregnant and one's not. The pregnant one has a higher chance of having a bad outcome. And when we look at babies who are born from moms who have COVID and babies who were born from moms who did not have COVID, there is a higher risk that the baby from the mom who did have COVID will be born prematurely and could end up with significant problems. So overall, we know that it's important that women really consider having the vaccine, be informed about what's going on with the vaccine, make their own personal decision about it, but really look to the science. And the science is really coming forward as to what the experience has been in this country with the vaccines that we've had so far. So really encouraging what's going on.
And I think it speaks to one of those dynamics that we've talked a lot about, which is the relationship between a woman and her gynecologist. I mean, it would seem to me that never would that relationship be more important than at a moment like this. Can you talk a little bit about that dynamic between a woman and her OB-GYN during pregnancy, how important it is to have that relationship?
So it's such a unique relationship because when women are pregnant, we have two entities that we need to take care of and protect. We have the mom and we have the baby. And it's really important that both are represented. And it is only your OB-GYN who understands how significant that is. And there are times in which there are different interests, right? What's good for the baby may not be good for mom, and what's good for mom may not be good for the baby. But the only person who can really help you to navigate that is your OB-GYN, because that OB-GYN has both mom and baby's interest at heart.
Wow.
And it's a unique relationship in medicine where you have two people to take care of.
We have a couple more questions I want to get to, although I'm sure that there are a lot of folks who would like more information on this or are still making up their minds. I would encourage you to go to our website, atlantichealth.org. We have a lot of resources there on our COVID section where you can get linked out to really trusted sources of information like the CDC, things you were talking about.
Right, the American College of OB-GYN. I think that's a critical issue, Luke, and if I could take a minute to really talk about that. I think it's really important that we are careful about who we seek information from. And as I always explain to my patients, there is no filter on the internet. So anybody can say anything. It is critically important that you go to the people who are really based on science. So I would recommend the American College of OB-GYN and the CDC are really great sources. Many large institutions, health systems, have a lot of great information on their websites. Again, trusted areas that you should go to, but it's really be careful about other areas that you go to because I don't know what they're telling you.
Sure.
And that's critically important, that in these incredibly important times, you understand the science of what's happening.
So we encourage folks, as we've been saying, if you do not have a relationship with a gynecologist, please go to our website or speak to your primary care physician. Maybe
Exactly.
they have a relationship with one that they would
Perfect.
recommend. And go ahead and start building that relationship. A couple more questions. Let's
Sure.
pivot to a different issue. A couple of the questions we got were around urinary incontinence.
Yeah, important topic.
Yeah, and one that I think a lot of people are submitting these questions, and essentially they're sort of along the lines of what do I do, right? Do people have to suffer through this, right? Are there solutions to this challenge in whatever form they may be?
So there are lots of different solutions. Some of them are medical and some of them are surgical.
Okay.
Right? And so it's really important that you speak to a source that can give you different options. There are even subspecialists in the world of OB-GYN who deal with this. But really, your trusted person is your gynecologist who can help you to decide, is it a medical approach you want to take or a surgical approach?
And when you say medical, you mean something that can be treated with medicine versus a surgical procedure?
Right. So so either way, and it's really important that the variety of options that are right for you as an individual are really handled. And that's why it's important that you work with somebody you trust, who you've had a long relationship with, who understands you.
Okay. We have a question here which it speaks to the overall picture of health that a gynecologist can develop for women. Marilyn asks, if a nipple in your breast is inverted, is that something to be alarmed about? And I think it's a concept of knowing your whole body and being able to point out areas of concern when they arise.
So I think that's a really great question and a great point. So again, that's a really helpful thing, that if you had a long-standing relationship with your gynecologist that they may have noted, that you've had it for years. And my advice to most patients is something that you've had for a long time, we're less worried about than something that is new. Again, but it's a conversation that you need to have with your physician because everybody is different. But it's really important that it was noticed and noted and needs to be taken back to your gynecologist, because that's something that they would be very interested in seeing and then helping you to manage.
We have a question here and I'll straight up, Medicare, we're not going to comment on what Medicare should or should not be covering. That is a policy question best left to people either in Washington, D.C. or in other places. But the heart of the question really is that it covers an exam every 2 years. And is that enough for older women? So I guess it's about this idea of frequency of examination. And so I guess, do we have a thought on that? Again, we're not commenting on what Medicare should or should not be covering.
So that's a difficult question because older women is a big group of patients, right? And everybody sees themselves differently.
Those are their words, not mine.
No, I get it.
I didn't phrase it that way.
And so you could see yourself as older in different times. And so we encourage everyone to have an annual exam. What their insurance will or will not allow is a different story. Sure. But certainly if there's an issue, whether it's in 6 months or 2 years, it needs to be brought forward. And I think that's a discussion you also need to have with your gynecologist. Is it reasonable to wait 2 years, or is this something I need to have again next year? So again, about your relationship of your trusting with your physician as to what they recommend for you.
And your insurance company folks will be able to tell you whoever you're covered through will be able to tell you what you're eligible for. So a quick phone call to them is always a great way before you seek care to know what your options are financially. We have another question. Okay, so Suzanne is looking at this from the other side of things.
Okay.
At what age can you stop seeing your gynecologist?
So I would say never.
No, I was going to say, now you're talking to somebody who's going to tell you never.
Right. So it's when you feel that you no longer need any advice or help with any of these issues.
Okay.
And I would argue that we always need advice or help with any of these issues. If you feel you have no issues that want to be brought forward, if you have a primary care who's managing your blood pressure or your diabetes or anything else, one of my concerns is that people always assume that a gynecologist is just about birth control and just about getting pregnant. And really what it is, it's a lifelong trusted experience with somebody who cares about you as a person and as a woman. And there are different issues that present at different ages. And so it's really an individual decision.
We have a question here from a member of the transgender community who is curious about the relationships between gynecologists and those folks. The comment we've had is, the question is, is a trans man on testosterone but still asking for a pap smear? Do I need a gynecologist and those types of relationships? What information can we share?
So I think it's really important that whoever you go to is a physician that you trust and feel comfortable to bring up any and all of these issues. And I think that's the point I'm trying to make, is that it's a trusted relationship with whatever healthcare provider you choose to go to. So if there are issues related to any of the topics I've brought up, then a gynecologist makes a lot of sense. If they're not, but the bottom line is you need to find somebody who you feel comfortable having these discussions with.
And I think we titled this why every woman needs a gynecologist, but I think really it's broader than that in the sense that it's why you need to have a trusted relationship with a physician, because there's only so much that you or I are going to be able to share with them today, because that long breadth and depth of experience and knowledge that comes over time is something that we can't just necessarily touch on at a Facebook Live. But we do appreciate everybody checking in and asking those questions. So we are just about out of time. I know half an hour seems to fly by rather quickly in these formats. Anything at all that we missed that you think we want to share with folks? I ended sort of with that question of when do you no longer need a gynecologist, but is there anything we missed that we want to touch on?
So I think I started with this and I want to end with it. Many times the discussion with a gynecologist is about things that people are uncomfortable talking about with their physicians, other physicians. Mm-hmm. I would argue that gynecologists are here to talk about those uncomfortable things. Many of them have to do with intercourse, vaginal dryness, menopause, anxiety, depression, weight loss, any of these things that happen that, like I said, you have those discussions with your sister or maybe a girlfriend.
Confidants in your life.
Exactly. And so really these are conversations that your gynecologist wants to have with you. And I think that's really what's important, is that trusted relationship as we go through the different decades of life. And women are very active for many, many years now. The world has changed, right? We're no longer saying stay home and sit in your rocker. We're saying get out there and be healthy and enjoy life, and we want to help you to enjoy life and not have worries or fear about things that we can help.
Were you heartened by how many? We get usually a lot of questions during these. Some topics generate more than others, but we got more than our fair share today. Is that encouraging to you to see that level of general willingness to share questions in a public forum like this? Do you think that's a good sign for?
I think it's a great sign. I also know that women need gynecologists because we talk about things that other people don't like to talk about. And so I think that speaks to the idea that people have a lot of questions and that they need to have that lifelong relationship with their gynecologist.
Well said, Dr. Contreras. Thank you so much for joining us today.
Oh, well, thank you. It's a topic I love to talk about.
Excellent. Well, folks, I appreciate everybody joining us today. Like we said towards the top, if you missed any portion of today's conversation, the entire thing will live both on our Facebook page, but also on our website, atlantichealth.org, where you can also find the Find a Doctor link, which we talked about earlier. Or you can subscribe to our YouTube channel, which I suggest you do as well, because we do these every couple of weeks, and we cover all kinds of topics. So maybe a gynecologist isn't the perfect match for you today, but we very well may be talking about something very important to you next week. So be sure to tune in then too. But that's it for Dr. Contreras. I'm Luke Margolis. Thanks so much, and we'll see you next time.
Thank you.